Okay, so as we mentioned, the blood supply of the uterus is from the uterine artery, which is a branch of the internal iliac artery. The cervix, it is 2.5 to 3 centimeter in length. It is thick tubular structure. The ureter run about 1 centimeter lateral to the supravaginal portion of the cervix, and this anatomical position of the ureter is of importance during the process of surgical manipulation of the uterus. So, be aware about this vital anatomical organ. The vaginal portion project into the vagina to form the fornices. As we mentioned, we have 4 fornices, 2 lateral and 1 anterior and 1 posterior. The upper part of the cervix is lined by columnar epithelium with a glandular element. It secretes clear alkaline mucus. The external os of the cervix is changed into stratified squamous epithelium in the external os or external part of the cervix. The blood supply of the cervix, we have cervical branch of the uterine artery. Again, this is the picture which shows to you the parts of the cervix, which is the supravaginal part and the vaginal part. It's lined. This is the endocervical canal or internal cervix, and it's lined by columnar epithelium, while the external cervix is exposed to the vaginal part, and so it's covered by stratified squamous epithelium. The uterine axis is normally about right angle with the vagina. We call it anteversion. 20% of normal females, they have backward direction of the uterus. We call it retroverted, which is normal phenomena, normal deviation. The fundus will faces the sacrum posteriorly. At birth, the cervix is twice the length of the uterine body, and during puberty, the uterus will grow under the effect of the hormones secreted from the ovaries, and the uterus will become larger size than the cervix. At menopause, with the deprivation of the estrogen and progesterone, the uterine size will return back again to a smaller size equal to the cervix. This picture shows to you the anteversion of the fundus of the uterus, which means that the fundus is facing the anterior abdominal wall, while if it is directed posteriorly, we call it retroverted. The fallopian tube from the cornua of the uterus to near the ovaries, they extend, where it opens to the peritoneal cavity, and they convey the ovum. Its function is to convey ovum from the ovaries to be fertilized with the sperm inside the fallopian tube. Each tube is about 8 to 14 centimeter in length and is divided into parts. The interstitial part, which is near the cornua, isthmus part, and then the ampullary area, which is the widest part of the tube, just below the fimbria. The fimbria is the free ends of the tube. The tubes are lined with ciliated columnar epithelium. The wall consists of inner circular and outer longitudinal muscle fiber, and the function of this cilia is to move and direct the oocyte toward the uterus once it is fertilized. So any abnormality in the ciliated movement, we will have an abnormal condition. We call it ectopic pregnancy. The blood supply from the uterine and ovarian arteries. The ovaries, the ovarian size, each one of the ovary, it is of almond shape, solid, grayish pinkish in color, about 3 length by 2 centimeter width and 1 centimeter thickness. At birth, they contain, as we mentioned, 1 to 2 million of primordial follicles, and these follicles with development will be atretic and depleted till pubertal time. The ovary is the only intra-abdominal organ that is not covered by peritoneum. It is attached to the cornua of the uterus by an ovarian ligament and to the lateral pelvic wall by infundibulopelvic ligament and posteriorly attached to the broad ligament by the meso-ovary. The ovary consists of three parts, as we mentioned: the medulla, dense covering epithelium, which is the cortex, and the germinal cell. And if you remember, these are of three embryonic origin. This picture shows to you the posterior part of the uterus, and the ovaries are attached posteriorly by the meso-ovary. This is the meso-ovary, and to the uterus by the ovarian ligament. Again, laterally here is the infundibulopelvic ligament. The pelvic muscles and ligaments: the pelvic diaphragm, which consists of mainly levator and knee muscle, and this is major support of the pelvis. The urogenital diaphragm, which is a triangular layer of fascia filling the gap between the two descending rami of pubic bone pierced by the urethra. So these pelvic muscles and ligaments play a major role in supporting the pelvis and the perineum of the female. The perineal body, it is a mass of fibrous tissue lie between the vagina and anus, and it is the site of insertion of perineal muscle. Blood supply of the pelvic organ: it takes supply from ovarian, internal iliac, superior iliac artery, and drain the blood back through the internal iliac vein and internal iliac, inferior vena cava, and left renal vein. Lymphatic drainage is to the external and internal iliac lymph nodes, obturator lymph nodes. Some goes with the round ligament to the inguinal group, aortic lymph nodes, and other passes to the para-aortic lymph nodes. The nerve supply of the vulva and perineum mainly from pudendal nerve S234, and some from ilioinguinal, genitofemoral nerve, and posterior femoral cutaneous nerve. The pelvic visceral nerve supply from the pre-aortic sympathetic plexus, uterovaginal plexus from T10 to L2, parasympathetic plexus S234. And thank you. If you have any question, please don't hesitate to ask me.